This is going to be short, and if you have any questions afterward, please let me know. Over the past 10 years, Emory USD has developed a credible wellness program. The school-based health center is a place to house those resources. The Wellness Center will house the following departments: the School-Based Health Center, the Family Resource Center, Psychological and Social Services for Emory USD. But don't let the name fool you. We've always considered Emeryville community in our planning, especially concerning health resources. ECCL is a place where all those plans can be housed. Our initial desire 10 years ago was to fill the need of a lack of any medical or social services for our students and families within the close area. We've expanded the outreach to the community because Emory families are community and citizens. What is good for them is good for our shared community. The opportunity exists to include and enhance an already existing partnership between Emory USD and the City of Emeryville. Currently, the Family Resource Center, as an example, resides at the Emeryville Recreation Department, and we serve schools and community families. We've always worked with the Recreation Department and Senior Services, thank you, Cindy, from beginning to the planning services for all of these needs. We've partnered with Alameda County School Health Services, which is part of Alameda County Health Department. They've opened 20-plus school-based health centers. Last year, they agreed to work with us and put out an RFP for a medical lead. The two leads that were considered by them were La Clínica de la Raza and Lifelong Medical Services. They chose Lifelong and awarded them the planning grant to help with this facility planning, with funding, and with all the other architectural designs we were working on at the time. They, along with our other partners, the California Health Centers Association, which actually recommended us going through Alameda County Health Services and Alameda County School Health Services, are working with us on planning things to go into the school-based health center. The Wellness Department last year, along with UCSF and the UCSF and the School-Based Health Centers Association, did a needs assessment. We went to the seniors, we went to the families, we went to the students, and we talked about what do you want in a health center? What would be good for you? What are you looking at? What's a priority? And so we have that plan, and we're using it to give us some ideas on what we should look at in terms of the community. The financial stability of the clinic is based on maximizing the services that they're going to provide, either through insurance payments from grants from the county as well as the federal government. There are many different types of grants once you have a brick and mortar institution that actually work with school-based health centers. And I know that the state, they've been lobbying the California School-Based Health Centers Association. Too many names, too many different people here. Anyway, are out there lobbying to make sure that we get federal as well as state money for those types of things, all school-based health centers. The opportunity exists for us to include a broader community input regarding programs and services. Lifelong is very interested in expanding their outreach to our community. To that broader conversation, we welcome any input and want to further city partnerships. I've worked continually with Melinda Chin, Cindy Montero, and Pat O'Keefe on this product and this project from the inception 10 to 12 years ago. Lifelong has lent us their design expertise to help us with the preliminary architectural plans for the clinic. So far, the space is general enough to function as a school-based clinic and a community clinic. We have not worked out the financial documents, operating documents, nor written any MOUs. This is a perfect time for the city to be at the table to discuss this and to work with us, Lifelong, as well as city services, which we are working with all the time to help us to figure out what else we need to do and what else the community needs. Do you have any questions or thoughts or clarifications?
I do have a question.
Yeah.
So Lifelong's role, you said they got a grant in order to help with the design of the project at this point. And after that is completed, after the project's completed, we don't have any extended contract with them, but they are a potential partner for actually providing the services or folding in other organizations? Because I don't know much about that organization in particular.
Lifelong Medical has been designated by the county as our medical lead. So they basically
Medical lead, is that
medical
what you
lead. What do you need a medical lead agency like Kaiser, or they're like Kaiser, they're like Sutter, they're like all of those. They're a medical provider and services in the Bay Area. And what they do is to help us to set all this up, but they are also medically, they will be running the clinic basically.
Okay.
They're,
So
they're doctors,
that's part
they're
of the-
dentists, and all the rest. And that was done through the county because the county designates money for the school-based health center when you have brick and mortar. And they bring those grants to fore because of the medical lead and through the medical lead.
So is the grant just covering the design phase, or does the grant extend into the actual
The grant,
services?
right now, as soon as we get a brick and mortar, the grant will be expanded, but right now, it's just covering the design phase. We couldn't get the full grant because we don't have a
Facility.
building. Yeah.
And do you anticipate, though, that the grant through Alameda County will cover the costs of having this clinic and, like,
It will cover the initial costs.
the initial costs?
We always have to, as any clinic, go out and make sure that we get people who come to the clinic, bring their insurances, look at Medi-Cal, Medicaid, fundraise, get other grants. I mean, this is not something that it's like anything else, but it will cover the basic cost initially. And then Lifelong also will be out there rendering services and looking to find monies and trying to bring things in because they want it to be a success too, because when you become Emory Unified School District's clinic's client, you become their client.
Right. Thank you for explaining that.
Jennifer, another point is that the financial model for running these clinics is that they're Medi-Cal reimbursable clinics. So the business model is one that is used with La Clinica de la Raza, Lifelong, and several other medical agencies that run clinics in the Bay Area. So
Which is one of the reasons we went through.
Right,
For us.
for us. That's what
Right.
what I'm
Yes.
trying to get at, I guess, is that, that as long as they have adequate number of people using their services, that it is revenue neutral
That's why
for,
we have the conversation.
for us,
Right.
for providing the facility.
If I could also remind you about the presentation we had from Alameda County Health at the last meeting, where Alameda County Health has stated that it's their intention to use school-based health clinics as a strategy to expand access to health services. And I know Lifelong Medical is one of the top 3 providers in terms of community health clinics in Alameda County, along with Asian Health Services and Clinica de la Raza. So we have one of the best. I should also say they also provide services for our residents at the California Hotel. And I think it would really be terrific at the appropriate time, once the school and the city have worked with the health providers to get a list of the services that they think they could provide, to have them come and do a presentation on what services they're intending. And because I know that their ability to see clients is how they fund their work.
Most definitely. Yes,
So, Juliette, I just want to say, first off, thank you, thank you, thank you. You were one of the first hires as we wrapped our minds around a full-service community, and you started all the wellness initiatives from the get-go, and this has turned into quite a sophisticated operation. So under your guidance and leadership and stewardship. So first of all, I want to give you big thanks and kudos to you. And I imagine it's been professionally satisfying to see this grow and develop. So with that being said, I want to put a couple of kind of exploratory things out there. First, the funding mechanisms for health services is its own study session, and which I can actually talk about because of my day job to some extent. But I think the kinds of medical services that we need have to include vision and dental. And those, Medi-Cal has fluctuated over time about whether they're going to cover those things. When they cut out dental a few years ago, and they're bringing it back to some extent. But if you're dealing with an abscessed tooth or something, that has significant ramifications health-wise because it's so close to the brain. So those things really need to be taken care of. So I think dental and vision are often overlooked in terms of other kinds of medical services. So those are priorities from this council member, that we be able to provide those. And the mental health services, which have already started, but need to be enhanced as well. One thing I would ask, and I'm sure Lifelong is trying to tap into every revenue reimbursement scheme there is, but the Affordable Care Act and California, which has embraced the Affordable Care Act with great gusto, has decided to expand Medi-Cal eligibility to 138% of the federal poverty levels. Depending on household size, those numbers change. So with that, I think there are 5 plans offered in Alameda County under Covered California, and we would need to find out if Lifelong, which of those plans has contracts with Lifelong Medical to be able to access payment for them for that. And that should, now that the call center for Covered California is up and running this week, but like I said, it was 5 million hits the first day on the website, we should be able to find out if Lifelong is in any of those plans' contracts. But we need to make sure that whoever gets in there to actually provide the service is a covered entity under any of the Alameda offered plans under Covered California. So those plans are here to stay. So we need to make sure we can line up to and have contracted providers under that.
It's interesting that you mentioned 2 things that I was thinking about today. One of the surveys, the survey that we did with UCSF and the School-Based Health Association, the number 1 desire by most of the people, whether they were seniors, students, or families, was dental care. And Lifelong does that. And we have 2 dental seats that we've already put into the plans for the School-Based Health Center because it's one of the best ways to bring in revenue, surprisingly, for a school-based health center. The other part was that I heard a commercial this morning with the chief operating officer for Lifelong, and they talked about Covered California, and they talked about the number to sign up. So I have this feeling that they are very much intimately involved in that process, and we will find out exactly which ones they are participating in, because they recognize and want to reach out to all parts of the community and want to do their best to make sure they cover people and people can come in and get the services.
So, yeah, I know Kaiser's a plan in this county. Alameda Alliance is another plan, and maybe Lifelong contracts with them. I don't know, but if they contract with
find
more
out.
than one plan, that would be great.
I'll find out.
The other thing is, as well as being a contracted entity under a Covered California plan, to make sure they're Medicare certified as well as Medi-Cal certified, because then we can serve the
The breadth.
disabled and senior populations.
Most definitely.
So those would be necessities from my perspective.
And I will be calling you.
Okay.
Okay,
Yeah.
great.
Member Asher?
Yeah, I have a quick question. I appreciate what Ruth said about having a study session about the,
Finance.
yeah, for the financing for the school-based health clinic, and that's good. I would like to see that. I want to better understand the funding mechanism, but I also want to see the budgets of a couple of school-based clinics and see what they're spending and see what their revenue is in very concrete terms so that I can understand and have a better idea of it as well. So if we do have a future study session on that, I just want to make sure that that's a part of it as well.
We can have
Like-
case examples. Yeah, sure.
Yeah, Lifelong runs 2 clinics,
Yeah, they
school-based
do.
health clinics. Also Alameda County Health Department, because they do, the school health department, because they have 20-plus clinics, they can bring, we'll have both of those entities at the meeting to explain exactly how they interact, what goes on, how do they do it, and what it looks like in the future and what it looked like in the past. So we'll have both of those people come. Okay?
I have a question that maybe Mr. Bonet might know. Our free reduced lunch population is 70-odd%. Sometimes I see 80%. The question is, do we know what percent is free? Is the qualify for free lunches, it's 130% of poverty, which would meet the the new expanded Medi-Cal,
Yeah,
135%,
underneath that, yeah.
so.
I don't know that off the top of my head. Our unduplicated count with EL and low income is 74%. The form where I get that information from does have that breakdown, so I can bring that back to the board or city schools.
Sure. But I would think, at least 30% or so of our student population probably falls under the free or the Medi-Cal limit.
I see what you're saying.
Most-
Sorry,
most
I didn't
importantly-
understand what you were saying,
Yeah.
but in
Yeah.
terms of, or for some reason, it's just kind of not going in there. But with Medi-Cal, we have a relationship with reimbursement from MA, which is Medi-Cal Administrative Assistance, and our percentage for Medi-Cal that they have is about 43.2.
Okay.
Oh, there you go.
There you go. Perfect.
I don't know.
Can you, besides MAW, can you use TCM, Targeted Case Management, as well?
We can. We also have leader services, and we're doing Medi-Cal billing, which we're going to try to increase and do some things there with the people that we have on campus. We're learning how to do that. And when you try to add all of those things in at the same time, it makes you a little crazy. So we're trying to do that this year. But MA and itself, they're two different billings, reimbursement and billing. The MA reimbursement is going through some changes right now through the federal government. But as soon as that gets all ironed out, then hopefully we'll be able to add that into. Okay? Sorry about that. Didn't quite get it.
Other questions on the health, school-based health clinic presentation?
I just have
Okay.
one quick one, which is, what do you anticipate, or maybe another example from another school-based health clinic in terms of hours? Is this something that is aligned with school hours, or does it extend into the evening? Is it open on Saturdays? I'm just curious what kind of projection you would expect.
Well, we've been meeting, Cindy and myself and Roy and the architects and Lifelong. We've been meeting and going through all kinds of different hours. Right at the beginning, we were going to start out with about 20 hours a week and then expand, depending on how many services that we needed. And we would open early for, like the seniors would come in from 7 to 8. We'd have confidential hours for students during the day, and then in the afternoon, we would have families and community come in the afternoon. There's a whole big spreadsheet and chart. So we've been looking at all three of those different things to make sure that we have a covered time period where we can still maintain the confidentiality for the students, but we can still take care of seniors, because God knows students don't want to get up at 7 o'clock in the morning, but seniors are happy to come in and do those kinds of things. And then in the afternoon, students are in the classroom, so we can take care of students and, people who want to come in and into the, so we're thinking about all of those things. And they're all part of the planning process and will continue to be. And hopefully, not hopefully, the clinic will be a success, and we will expand to Saturdays and Sundays, depending on fiscal, what's the word there?
Sustainability.
Thank you very much. And Lifelong is very amenable to that, as well as we are, So those are the kinds of things that we're looking at, because it doesn't make any sense to not do it if somebody doesn't come. But then we're also working now to get those kinds of programs started so that we can transition them an already full-fledged product into.
Can I suggest?
Lifelong just started a clinic in Richmond earlier in the year, operating 20 hours a week.
Can I suggest to
McDonald Avenue.
the extent we're working with mental health providers such as Ann Martin Center, you might want to include them in some of these discussions, because some of the hours when the clinic's closed, it might be possible to work with kids in counseling, so that we get double use of some of the space.
Oh, most definitely, and the Family Resource Center will be a part of this building, as well as our psychological and social services, the school social worker, and all of those folks will be in the area also, and in the same building, so that we'll be open
That's great.
a lot more time than just the clinic itself. Okay?
So is there articulation of what the city's desires and needs are with respect to the school-based health? Because I don't have that in my mind. Sounds like you've been having these conversations, that seniors coming in and families, and vision and dental is on the list, and it would be helpful for the school board to know.
Okay. One of the things that I think we sent it, but I'll send it again, the assessment that we did last year, with UCSF as well as the School-Based Health Association. I think it talked to the seniors and several other different families as well as students, and I'll send that in, and it articulates what would be the priorities and what's going on with what people want, what they desire, and what they thought was necessary in the area, both mental health, physical health, and all the rest.
So those are the survey results you're
Those
talking
are the
about?
survey
And
results.
My question, which I would love to see.
Okay.
My question was specifically, what are our city partners' priorities and desires for the services that they'd like to make sure is available to the community? Or should we have that discussion here, or should that be a study session, or how should we?
Yeah, we haven't had that discussion separate from our city schools meeting. So perhaps that would be good to either agendize on the city council so that we can have our own discussion and not use the city schools' time and report back.
That would be a good thing, because I don't have it. Okay.
Member Brinkman, were you going to?
Well, I was going to say, if the students have these issues and needs, I would think the adults would have the same issues and needs. So, you know, I would think that they go hand in hand. If a child doesn't, you know, needs glasses, most likely somebody in his family needs glasses, and the same thing with dental care. So I would think it's just concurrent with what we do for the children, we do for everybody in town, especially with the mental health issues, because we're seeing more and more of that around our city. So.
But it'd be good to look at the demographics of the city, which is slightly different than the demographics of our school district families, and just to understand better, you know, how many folks are covered, and with the, well, coverage is changing, I know.
Yes.
But how many folks might actually use these services, and if we could get a sense of that, would be really helpful.
Okay, I'm going to, why don't we see if there's any public comment on this aspect of the presentation before we move to the library services. Any public comment on the health clinic? Seeing none, why don't we move to the second